Yes, my computer is
Okay, all
not
right.
doing justice.
Okay, I'm going to share the screen and play this slide. Just give me 1 moment. By the way, Madam Stephanie, we still look forward to your presentation in French this month. So we're going to share with you about the topics and also uh, very possibly the last presentation, we're going to invite you to present us in French.
I'll be honored to do so.
All right, so the first topic is about the fatty liver disease.
Are you ready with the slides?
Can you see the screen?
It's loading.
Okay, now can you see
Yes, I
the
can.
slideshow?
I can see you just have to expand it. Yes.
Now can you see the slideshow?
Yes, now I can.
Okay, all right. Then you can tell me when I'm going to go to the next page, next slide.
All right. Thank you again for helping.
Welcome.
All right. Good evening, everybody. My name again is Stephanie Kalenga, and today we'll be discussing the topic of our liver. And we'll have on my side two subjects, the fatty liver disease, as well as the hepatitis B and C, the viruses that we can get that impact our liver. So we should start with the slide 1. Yes, why are we learning about the liver and why is it important? That is the first beginning. We should understand that the liver is one of the hardest working organs in our body, and it's responsible for detoxifying our system, and it also helps with the metabolism system as well as the breaking of nutrients and its storage. So we need to have our liver very healthy because it's one of the most important detoxification centers of our body. But unfortunately, so many people suffer from the fatty liver disease, and they do not actually notice when it starts and until it becomes very late. The whole world is suffering from fatty liver disease, and most of the people do not really pay attention to it. And in Africa, it's becoming increasingly increasing as a silent epidemic. And also in Africa, most of the people, they recognize HIV, malaria, hepatitis as historical dominant public health discussion. But the fatty liver disease, up until now, it's one of the diseases that is not actually much discussed. And it's rising very rapidly and at an alarming rate. Slide number 2, please. Okay, so what is a what causes a fatty liver disease? The fatty liver disease is also known as hepatic steatosis, which occurs when there is excess fat buildup of fat cells around the liver. And normally liver itself contains some fat, but once the fat is it's more than 5% or 10% heavier than the liver itself, that constitutes a problem. And there are two main types of liver diseases, and I will need you guys to note because most of the time I'll be referring to the abbreviation of the word. So the first type is the non-alcoholic fatty liver disease, which in short is called NAFLD. And this one occurs to the people who drink sometimes a little bit, and sometimes they don't drink alcohol at all. But this disease can get to them due to poor diet, obesity, or sometimes diabetes. And the second type of people who suffer from fatty liver disease are called the alcoholic fatty liver disease. Those people, in short, we use the term AFLD, and this one is caused due to excessive consumption of alcohol. There are people who drink a lot on a daily basis and overso during the weekends, and this can cause damages to the liver and can lead to a buildup of fat on the liver. So as I said, please remember the short version. I said the first time the non-alcoholic fatty liver disease, which is NAFLD, is now the most common liver disorder globally. And this one, it affects 20 to 30% of Africans with higher rates in urban areas. And some countries, example, South Africa, Egypt, Nigeria, the NAFLD affects over 40% of obese individuals and diabetics. We can go to slide 3. Now, fat accumulates in the liver due to an imbalance between fat intake, production, and removal. And we have some causes of fatty liver disease, which of one can include insulin resistance and metabolic syndrome. When the body becomes resistant to insulin, which is a common reason of obesity or diabetes type 2, the liver produces more fat and it struggles to process it. And high blood sugar and triglycerides further worsen the buildup of the fat around the liver. The second reason people suffer from fatty liver disease is a poor diet. When people consume excessively sugary food, refined carbs, saturated fats, example, fast food, sodas, pastries, all of these things can overwhelm the function of the liver, which in turn can become very harmful to the liver, and it affects the metabolism system of the liver directly, which makes it harder to process the fats around the liver and in the liver cells. The third reason can be abuse of alcohol. We know weekends we like to drink, but when it's overly so and repeatedly every other weekend we are out drinking a lot, alcohol is broken down in the liver. And when it's taken into excess, the toxic byproducts that promote fat storage can cause inflammation, and it becomes harder for the liver to break down the alcohol when the body is taking it. So Africa has some of the world's highest rates of heavy episodic drinking. Countries like South Africa, Nigeria, and Uganda have reported high alcohol-related liver disease cases. And the fourth cause that can lead to fatty liver disease is secondary lifestyle. So as in secondary lifestyle is increasing, some people sit on their desk job the whole day. They are motorized transports, they reduce manual labor in today's world. People are on their computers, they are working all day sitting, which leads to lack of exercise. And lack of exercise slows down the metabolism. And when someone has a slow metabolism, it becomes harder for the fat that is being accumulated to be expelled from the body. The fifth reason can be the coexistence of liver diseases. And this happens when someone already have a problem like hepatitis B or hepatitis C, and then they find themselves also suffering from a fatty liver disease. When these are combined, they can accelerate the liver damage. We can move to slide 4, please. So initially, fatty liver may cause no symptom, but if it's left unchecked and people are not looking at signs that cause and can come from liver diseases. I saw, Ma'am Rani, you've already passed the page of signs. I just want you to go back on the warning signs. Yes, just one slide back. Yes. Oh, no.
No,
Go
the
back.
warning
Go
signs.
forward. From this one, you go to the warning signs. It's
Yeah,
the
this
one
is
that
the
I'm
warning
looking
signs.
at.
Yeah.
Yes. You see, some people experience excessive fatigue. Some people experience abdominal discomfort, jaundice, which can be shown in the eyes being yellowish and the skin turning yellowish, and lack of blood circulation. So the palms, the feet of the hands can be very yellow. And some people can experience swelling in the legs as well as the abdomen, and some unexplained weight loss, when people are just experiencing weight loss. You eat, you do this, you do that, but you're not getting any better. So now we can move to the next slide. Yes, so I was saying that initially fatty liver may cause no symptoms, but if it's left unchecked, it can progress through dangerous stages. And simple fatty liver, which is a steatosis, which is harmless when caught early, can worsen. And when it worsens, it turns into steatohepatitis. And this one can be for the people who are NAFLD or the people who are AFLD. And when fats build up a lot around the liver, it causes inflammation and liver cell damage. So people can experience fibrosis, which is a persistent inflammation that leads to scar of the tissue formation. Some other people can experience cirrhosis, which is a severe scarring that replaces healthy tissue and impairs the liver function. Some other people can experience liver cancer or liver failure, which is the end stage. And this one now, the person to survive, they may require a liver transplant. Now we can move to the next slide. I need the one that talks about the diagnosis.
This one.
Your slides are not organized as mine. Yes, this is the one that I need. Yeah. So these are the methods that can be used to diagnose someone suffering from a fatty liver disease. The first one is a clinical assessment and a risk factor evaluation. And since advanced diagnoses are not always available, doctors first look for risk factors, which are like obesity, especially around the abdominal area. The second thing the doctors look at is diabetes type 2 and the people who are insulin resistant. They will also look for people suffering from high blood pressure and people who consume alcohol excessively, and they'll also look for problems into the metabolic syndrome, as well as symptoms like fatigue, right upper abdominal discomfort, etc. So the second way of checking someone who's got a fatty liver disease is through blood test. And common liver function tests include ALT and AST. I did take some notes for our audience. The ALT is the aniline aminotransferase test, and this test is to measure the level of enzymes of the ALT in the blood. And that enzyme is primarily produced in the liver And the second test is the AST, which is also called aspirate aminotransferase test. And this one also measures the enzymes of that AST in the blood, and it usually helps to diagnose liver damage or diseases. The next test they can do is the GGT and the ALP, which may indicate alcohol-related damage or bile duct issues. And the other test they can do is a fasting glucose and HbA1c, which helps to check people who are suffering from diabetes. And also they can use lipid profile, which helps them see the people suffering from cholesterol or high triglyceride. The other way they can do is through ultrasound, and that is what is mostly used around the world because the ultrasound is most common and most affordable. And in Africa, it detects fatty infiltration, bright liver appearance. It's also non-invasive and it's cost-friendly, but cannot also detect if there is inflammation or if there is fibrosis on the liver, unfortunately. The other way that can be used, which is most expensive, is the fibroscan. Most people are not able to afford the test, but it's the one of the tests that measures the liver stiffness, which is the fibrosis, and also the fat content score. And this can be sometimes costly in our African countries, but countries like South Africa, Nigeria, and Kenya, you will find hospitals, major hospitals, if you go to our Steve Biko or Johannesburg Gen, these tests can be done. The next slide, let's see if it's correspond with my, yes, that's the one. So now we're talking about how is fatty liver disease treated. So there is no specific medication for fatty disease. For fatty liver disease, but lifestyle changes can reverse it in early stage. So we should take precaution to lose weight for people who are obese and also to change our lifestyle in our diet. So when someone knows that they are storing 5 to 10% of extra fat on their liver, they can start looking for ways to significantly lose weight. They need to eat more vegetables and lean protein, whole grain, healthy fats like omega-3s and olive oil for cooking, replacing the regular oil that they use to cook. They have to stay away from sugary food, refined carbs, fried food, and excessive alcohol. And also they need to manage to exercise regularly. These are the ways that can help someone who's suffering from fatty liver disease when caught early to learn to live a better lifestyle. But our product can also be of help when dealing with liver diseases such as fatty liver disease. So we have products like Livergen and our Hepat capsule. Either Livergen capsule or our Hepat capsules, they are loaded with antioxidants from its herbal ingredients. They have anti-inflammatory properties that alleviate the inflammation of the liver cells, and they also improve the regeneration of the liver cells, and this help in lowering the elevated liver enzymes in those that have liver damages. We also have the next product we can use is our JQQ fresh drink. Yes, that's the one. This product helps those who drink alcohol beverages to break down the alcohol in the liver rapidly with a minimum damage to the liver cells. And it can also be consumed before or after the person has drank his alcohol. The next product is our Ganoderma capsule, our Ganoderma Plus capsule. Yes, with our Ganoderma, this product has been shown to increase the activity of glutathione, one of the body's most powerful antioxidants, which is especially important for the detoxification process in the liver. It may also enhance the liver regeneration by promoting the growth of new liver cells. Ganoderma may also help in slowing the progress of liver fibrosis. And this is done when it reduces the activity of the fibrogenic pathways. Example, transformation growth, factor beta, and promoting fibroblast apoptosis, which is the death of our cells. So this Ganoderma can help in preventing these problems. And also it can potentially prevent or slow the development of cirrhosis. We also have as a next product we can use for our liver to treat the fatty disease is the deep sea fish oil. Yes, our deep sea fish oil capsule is rich in omega-3 fatty acid. And this fatty acid can help reduce hepatic triglyceride synthesis. In turn, it can decrease the amount of fat stored in the liver. Omega-3 fatty acids promote the breakdown of fatty acids, oxidation in the liver, which reduce the fat accumulation. They also improve the liver ability to process and eliminate fat. Another product we can use to reduce our fatty liver disease is our lecithin capsule. Lecithin capsule. Yes. Lecithin helps break down fat in the liver and it aids in the transport of triglyceride out of the liver. The triglyceride is the bad fats that are stored in our liver and that sometimes the liver struggles to release. So when we take lecithin, we are enabling the transportation out of the liver cells of those triglycerides. And when they are transported out, this promotes the production of lipoprotein, especially very low density lipoprotein, which carries fats from the liver to other parts of the body for energy utilization and storage. This process helps to prevent the accumulation of fat in the liver. So to sum up this part of fatty liver disease, we learned that the fatty liver disease is a silent but preventable condition. While it often starts without any symptoms, it can lead to irreversible damage if ignored. So the good news is that we can use our Greenwell product to improve our liver functions. We can change our lifestyles so that we prevent and if we find that we have problems with fatty liver, we can reverse it at the early stage. So if you are at risk of overweight, if you are at risk of diabetes, or if you are a heavy drinker, you need to take action now to protect your liver. The next topic that we are going to go to is the hepatitis B and C. Thank you, Ma'am Rani.
Thank you. If you have
And
any
thank you all
questions,
for the first part.
thank you. If you have any questions concerning the topic or the products, so please kindly, you can type your questions in the chat box, or after the presentation, you may raise your hand and have an interaction with our presenter. We are all here to answer your questions. So now let's go to the next question. So go to the next topic. Also, this is another important diseases, disorders about the liver. This is the kind of viral infection, the hepatitis B and hepatitis C. Okay, so let me play the slideshow first. Madam Stephanie, are you still with us?
Yes, I'm still right
Okay,
here
all
waiting
right.
for you to catch up.
Now, can you see it? Now, can you see the slide?
Not yet. Not
Oh,
yet. You're not
okay.
there yet.
Okay,
Yes.
let me restart it. Now, can you see the slide?
It's loading. Yes, now I can see.
Okay, all right.
Thank you so much. You can just yes, expand it for me so I can be able to see. Okay, good. Thank you. So now we are going to discuss the topic of hepatitis B and hepatitis C. What are those? We are going to discover and how we can treat and prevent these diseases. So again, please, if I mention a word, then you refer in mind, like for hepatitis B virus, we'll be using the abbreviation HBV, and for hepatitis C virus, we'll be using HBC. I mean HCV as an abbreviation. Now, hepatitis B and C are both viral infection that primarily affect the liver, and this can lead to inflammation and to serious complications, including liver cirrhosis, liver cancer, and even death if left untreated. So despite being preventable and treatable, millions worldwide suffer from these infections, often without knowing it until serious complications arises. Slide 2. No.
Courses and transmission?
No. Not causes and transmission. It's the B part of the one that you have. Yes. So
Okay.
what are hepatitis B and C? While hepatitis B, that I just said HBV, and hepatitis C, which is HCV, share similarities such as transmission routes and potential long-term effects. They are caused by different viruses and they have distinct characteristics. For hepatitis B, this one is caused by hepatitis B virus, which can survive outside the body for 7 days and is more infectious than HIV or even HCV. And sub-Saharan Africa has one of the highest HBV infection rates globally. Hepatitis B can be either acute, which is short term, lasting a few weeks to a couple of months, or it can be chronic, which is long term, lasting a lifetime if untreated. Many adults recover fully, but infants and children are more likely to develop chronic infections. For HBV, vaccine is available and highly effective. For hepatitis C, this one is caused by the virus hepatitis C. It's often called a silent epidemic because many people don't know they are infected with this virus. Most people or most infections, 70 to 80%, become chronic, leading to long-term liver damage if untreated. And unlike HBV, there is no vaccine for HCV, but it is curable with antiviral drugs. Now we can go to causes and transmission. The slide, please. Yes, thank you. So both viruses spread through contact with infected blood or bodily fluid, but their transmission method differs slightly. Hepatitis B is transmitted through mother to child during birth. So when a mother is pregnant and is diagnosed with hepatitis B, likely the child that is going to be born will also get the disease. So this leads to, this is the leading cause of chronic HBV in Africa. 30 to 50% of chronic HBV cases come from infected mother passing the virus during childbirth. So without vaccination, 90% of infected infants develop chronic HBV. Unprotected sex with an infected person can cause also the person who doesn't have the infection to actually carry it. There is sharing of needles, drugs, use unsterilized medical equipment. These also can contribute to the contamination of the virus. There is also contaminated blood transfusion. In most of the country, we've developed equipment where there is screening of blood supplies. This doesn't apply, but so other places, this can be the cause of getting the infection. There's the sharing of personal items like razors, toothbrush. So when you use the razor of someone infected with HBV and thus we get a cut from it, you also have a high risk of getting infected. Now the hepatitis C is transmitted through blood to blood. So contact most common via needles. When at the hospitals, and for example, someone has been injected with a needle and then by accident the same needle come and prick you, the high chances of getting hepatitis C is there. It can also be through unsterilized medical or tattoo equipment. So you go to a tattoo parlor and then they're busy tattooing someone with hepatitis C, and then next you are online. High chances of you getting it, it's very likely. And there is blood transfusion. Like I said again, due to lack of blood screening in most places, can lead to contracting of hepatitis C. So less common for hepatitis C is sexual contact or mother to child transmission, unlike the HBV. So unlike HBV, HCV is not spread through casual contact like breastfeeding or food sharing. We can go to people affected with HBV. Yes. So people affected with HBV and those with HCV have similar symptoms. And many people show no symptoms initially, making these infections silent killers. When symptoms do appear, though, they may include on an acute phase, which is the early stage of infection, fatigue, fever, loss of appetite, nausea, vomiting, abdominal pain, dark urine, and pale stool. And they can also include jaundice, which is the yellowing of the skin and the eyes. And for chronic infections, for people who are recurringly getting the infection, it's if left untreated, chronic HBV and chronic HCV can lead to liver cirrhosis, which is the scarring of the tissue of the liver cells, liver failure, liver cancer, chronic fatigue, and joint pain. About 15 to 25% of chronic HBV cases and 70 to 85% of HCV cases lead to long-term liver diseases. Now we can go to diagnosis and treatment. Yes, thank you, Ma'am Rani. So how do the doctors get to diagnose the HBV as well as the HCV? Blood tests detect viral presence in the liver function. So blood tests for HBV includes HBsAg. That one, it stands for hepatitis B surface antigen. And then there is the HBV DNA, where they get to test the DNA of the virus inside our liver. The blood test for HCV includes the anti-HCV, the HCV-RNI. And they can also do the liver biopsy, where they take a little piece of our liver to study it and see which kind of disease virus we got. They can also do the fibroscan, and the fibroscan assesses the degree of the liver damage. So these are the means that are being used medically to detect the presence of either HBV or HCV in our liver. Now we can go to the treatment plan for hepatitis B.
Yeah, we are on the same page. This is the treatment.
Oh, yeah, I see. That's the treatment. Okay, so for hepatitis B, there is no cure, but the person affected with this disease can take antiviral medication. And those medication can help in controlling the virus in the liver. And the regular monitoring can prevent liver damage. That is for hepatitis B. And for hepatitis C, curable with direct acting antivirals, DAAS, like sofosbuvir, which are treatment that can take. These ones, they have a success rate of 95% plus. So when taking this medication, it can help at up to 95% rate of success in recovery. And no long-term infection if treated early. So when someone is discovered to have hepatitis C and they take actions directly, they have the chance of fully recovery. Yes, that one is the one. So we can go to prevention and method. Yes, thank you. Hepatitis B prevention, we have vaccinations available. They are in 3-dose series and they're very highly effective. And for people, avoid having unprotected sex. So when having a partner that is not your husband, please use condoms to avoid spreading the disease, or if not known yet, to give it to the next person. Avoid sharing needles and personal items like shaving kits and sewing needles. And for pregnant women, screening pregnant women to prevent mother-to-child transmission. So when a woman finds that she's pregnant, she has to make sure she goes to the hospital and get herself screened for hepatitis B so that she does not transmit it to her child. For hepatitis C, the prevention, unlike the HBV, there is no vaccine available. So we need to avoid needle sharing because we learned that with hepatitis C, the transmission is from blood to blood. So we have to make sure that we avoid sharing needles or sharp objects. We have to ensure sterile medical equipment when used. And in tattoo parlors, people who are fan of tattoos, they have to make sure that those places, they have disinfectant for every time they finish tattooing one client before they can go to the next. And we have to make sure that they screen blood donations for those who do make use of blood transfusion, to make sure that the blood has been screened and that there isn't any hepatitis C inside the blood. And for people who like to play mujolo too much, please work with condoms in your wallet so that you do not give the disease to the next person. Now we can go to the next slide. For people who suffer with, this is our product. Again, we are going to talk about chronic hepatitis B or C. Your liver is under constant stress from inflammation and viral activity. So while people can take hospital medication like tenofovir for HBV or DAAS for HCV as primary treatment, Certain health supplements may also support the liver function, reduce inflammation, and slow the liver damage. Again, we are going to discuss our Greenwell products. For those who came late, this is your chance to catch up. We have our liver gen. No, please go back. Our Hepacho and liver gen capsules. Yes, I'm still there. So these ones, they have herbal ingredients in both of them that help slow down the replication of viruses, and they help repair the damaged liver cells. They also improve the liver cell regeneration. Meanwhile, some herbal ingredients in these two products contain antioxidants that help reduce liver inflammation and lower the liver enzymes, the ALT and the AST. The next product we are going to discuss is Ganoderma Plus Capsule. Thank you. Elevated liver enzymes often indicate liver inflammation or damage. So Ganoderma appears to have several mechanisms that may help reduce elevated liver enzymes. 1 second, my slide went too quick down. Yes, may reduce the elevated liver enzymes, such as its inflammatory, antioxidant, liver regeneration properties. Ganoderma Plus capsules also prevent and slows down the fibrosis and cirrhosis of the liver. The next product is the Blueberry Super Nutrition and our Spirulina capsules. So protein is vital for liver repair, immune function, and maintaining muscle mass. That's why we will be considering our super nutrition. Carbohydrates from peanuts and black beans provide steady energy and supports liver health, because we also learned that people suffering from liver disease have a lot of fatigues, if not chronic. Our omega-3 fatty acids, they support the absorption of fat-soluble vitamins like vitamin A, D, K, and E, and this helps in maintaining the cell structure. The vitamin E is vital for immune function and liver health. Vitamin D helps support immune function, and it also may play a role in managing the liver. Vitamin E acts as an antioxidant, helping to reduce liver inflammation and oxidative stress in the liver. B vitamins are important for energy, metabolism, and the proper function of the liver. Hepatitis may increase the body's need for certain B vitamins, particularly vitamin B and folate. Zinc is involved in many aspects of the liver function and immune response. So people with hepatitis, particularly those with chronic liver disease, may be deficient in zinc, which can impair the liver function. Magnesium plays a role in enzyme function and liver health. Low magnesium levels may contribute to complications in individuals with liver diseases. So hepatitis, especially chronic types like hepatitis B and hepatitis C, often leads to oxidative stress and liver inflammation. Antioxidants in blueberry and other ingredients may help reduce this damage by neutralizing free radical. So the next product is our Spirulina Plus capsule. Okay, it's already added there. The spirulina capsule is rich in vitamin B, all the Bs, in iron and amino acid, which helps combat fatigue, which is common in chronic hepatitis, and supports malnourished patients with a common advanced liver disease. Meanwhile, as it's rich in protein, antioxidants, and inflammatory compounds, it may help support liver function, which in turn will reduce inflammation and improve immunity. Okay, we can go to the next product. which is my slide keeps going up and down. Yes, slide 10. Diet and lifestyle. At the same time, we have some diet and lifestyle tips for you. So when you eat liver-friendly food, like cruciferous veggies, which is broccoli, your kale, your berries, your nuts, your lean protein, and if you avoid drinking excessively, because excessive drinking can accelerate liver damage. When we limit our processed sugar and fried food, this will help not only in decreasing the fat liver, but when we don't have a fatty liver and we don't have too much fat around our liver, we are having an increased chance of healing from those two types of HBV and HCV. And we need to stay hydrated. Drink up to 3 liters of water daily because this also aids our liver to detox itself. So as we go to the summary of hepatitis B and C, to sum up, hepatitis B and C are serious but manageable infections. While HBV can be prevented with a vaccine, HCV can now be cured with modern medication and also our green world products. So early detection, lifestyle precautions can help in preventing severe liver diseases. So if you are at risk, get tested. Early in the morning when you wake up, look at the color of your urine. It can also be an indication of how well or how bad your liver is doing. Thank you very much, everybody, for watching, and thank you for your time. I'm handing over to Mem Rani.
Thank you, Madam Stephanie. This were very wonderful presentations about of liver diseases. So you may understand that today, actually, the 4 topics uh, based on the liver and the gallbladder diseases. So we want you to understand fully about how to prevent and how to use our products to control those diseases. Just like what Madam Stephanie has mentioned, that yes, those diseases are very annoying and they can last for a long time. Somebody can carry the hepatitis B or C throughout the life, and this dramatically reduce the quality of the life. First of all, we understand liver is the top one important organs for detoxification. So those people, they almost all the toxins and the byproducts of the foods actually accumulate in the body, and they all they all have the harmful impacts of health. So first of all, Madam Stephanie showed you how to, from the early warning signs, how to realize that you could have the liver disease, and then what products you can use, or what physical examination you're supposed to take at the hospital to get your accurate diagnosis. So also the health tips, how to alleviate the signs and symptoms, because liver is a silent organ. It doesn't have the nerve. Even you have the liver diseases, you don't feel the pain until at the last stage, the liver actually expands, actually they stretch the nerves around the membrane of the liver. That is when you feel the pain. So let's see what questions we have so we can clarify many points about the liver. About the fatty liver caused by alcohol, it is also advisable to add anti-addiction. Well, this is very good. The products we present here are the basic products. So on top of the products, or based on those recommended products, you can definitely add, what you customize to your customer. For example, the fatty liver diseases caused by alcohol. You can also give the wake 酒精清, right? If the wake 酒精清 is available in your country, wake 酒精清 is a product specifically designed to help the liver to metabolize alcohol. And also you can add the anti-addiction to help that person, help your clients to get rid of the alcoholic beverage. How about chitosan? Does it help burn the fat in the liver? Exactly. Chitosan not only help to actually it's not to burn the fat in the liver, but help the fat to be transported uh, from the liver uh, into the bloodstream. And also, the chitosan is a binder, it's a fat magnet. In your small intestine, it binds with the, excessive cholesterol and fat and carry them out of your body without being digested. So this is how chitosan capsule is also very good products for fatty liver diseases. So this is a good point. I believe it would assist as it is a fat magnet. Does that mean that hepatitis B is part of STDs or HIV complexity if there's no cure? Uh, Hepatitis B can be transmitted through unprotected sex. This is very true. But you still understand. Yeah, hepatitis B share very similar route of transmit with the HIV. It is very true through blood products, through blood transfusion and blood donation, contaminated blood, and through the mother and child spread, and also through unprotected sex. Yes, this is very true. STD has a cure. You can use different antibiotics. Some of the STDs, you can definitely get the corresponding antibiotics from the doctor, but some of the STDs so far has no cure. For example, HIV/AIDS, we have the cocktail, we have the antiviral products or medicines, but still it cannot be completely cured unless you find it at a very, very early stage and use the complete package of the medicine and change your lifestyle. You can live a life similarly to an ordinary person. So this is HIV, and also for hepatitis B, we do have a lot of HBV and HCV positive people in China. Also, we give them the antiviral medicines plus the food supplements together with the lifestyle change. Yes, they can also survive into advanced ages and live a relatively good life as if they are the ordinary people. So that's true. Detect the diseases at early stage. Use the medicine and food supplement. Yes, you can maintain a relatively normal life. Hepatitis B treatment, especially for chronic infection, often requires a degree of patience. That's very, very true. It takes years because, the hepatitis B and hepatitis C, they have a very special strategies that they actually change the DNA of liver cells and, make the liver cells look like they are healthy to escape the immune surveillance of immune system. So this is how that is why it takes a very long time, years and years, for those people to be treated and healed, because a lot of medication are not really working properly on people with hepatitis B. And currently having hepatitis B patient in Malawi. We started the treatment journey last year, June. Very good. What was the first product? The first products always Livergen and Hepatsure. The products on the presentation going on. Yes. Thank you. So thank you very much for your wonderful presentation once again. Yes, lifestyle is very, very important. Thank you, and we are looking forward to your presentations in French this by the end of this month. So we can also give anti-addiction. Yes, anti-addiction is very good for detoxification. Thank you so much, Madam Stephanie. Thank you once again for your wonderful presentations. And then now let's continue with other two topics. One is the liver cancer, and the other one is about the gallstone. So, Madam Macharia, are you ready? I'm going to share the slides with of participants for today. So, which topic you're going to present firstly?
Liver,
Okay,
liver
liver
cancer.
cancer. Okay,
Yes,
thank you.
thank you.
Just a moment, you give me 1 second. I'm going to send, just give me 1 second. I'm going to send the message through WeChat. Just give me 1 second. Okay, all right. So let's continue. Now, can you see my screen? I start sharing my screen about the liver cancer. Can you see it?
Yes.
Okay, then I'm going to start from the beginning. All right.
Thank you so much, Madam Rennie, for this great opportunity. My name is Rahana Masharia from Kenya, and today we are really learning, and today for me I'll talk about the liver cancer and also the gallstones, the liver cancer and also the gallstone. And as Madam Stephanie have trained us, and we have learned a lot from her. We are talking about the liver, or among the most important organs we have in the digestive tract system. And when you talk about the digestive tract system, we have from the mouth up to the anus. And with what we eat, what we drink, what we take through our mouth, we usually say our mouth is for speaking and also eating. And what we eat produces a lot of toxins, and producing a lot of toxins, it's making a lot of disease. We having a lot of diseases because of what we do take, and we don't go for toilet or we don't detox. Over 100 diseases, and through the organs we have in the digestive tract system, liver and also gallstones are very, very important. When it comes to liver, it is, I think, the second largest organ in the body, And as Madam Stephanie has said, hepatitis B and C, and also we also have liver fatty affects our liver. And our liver, from there, we also have the liver cancer, and that is what I want to talk about. And how does liver cancer happen? Liver cancer is a serious disease where abnormal cells grow uncontrollably in the liver, one of the body's most vital organs. The liver plays a crucial role in filtering toxins, aiding digestion, and storing energy. So when cancer strikes, it can be a life-threatening. Understanding how liver cancer develop, its risk factor, and how to prevent it, it can help us save lives. And with cancer, we usually see cancer is the normal cells, with our normal cells growing abnormal cells due to carcinogenic things that we have around our areas. And the liver getting sick, it's very rare. You can stay for a long time without noticing that you have liver diseases. And liver cancer, it is the abnormal cells, growth of the abnormal self from the normal self, the growth of abnormal self from the normal cells, which happens that you will have the liver cancer. How does liver cancer happen? There are too many types. The liver cancer occurs when liver cells develop mutations in the DNA, leading to uncontrollable growth over time. These abnormal cells from tumors that can interfere with the livers and spread to the other organs. We have two types of liver cancer. We have the primary liver cancer. The next slide, we have the primary liver cancer. We have the primary liver cancer, and also we have the secondary liver cancer. The liver has no pain, as Madam Stephanie said. So the liver has no pain nerves. So tumors can grow undetected until they stretch the liver's out layer or invade nearby structures or organs. At the same time, a healthy liver can function even with 70% damage, making problems until advanced stages. That's why liver cancer is often called a silent disease. It is called a silent disease. As I said, liver is the second largest organ of the body. Even if you go for a surgery for the liver, it can work normally. It can work normally without any issue. Even if how small it is, it can work. It can work with you having no issues. So you can stay for long with no pain. And when it is prolonged, where the abnormal cells continuously grow, they can even start affecting the other parts of the body. We have the signs and symptoms of liver cancer. Many patients mistake early signs of minor illness, delaying diagnosis. Some are fatigue. We have fatigue. We have mild. We have fatigue. We have mild abnormal discomfort. We have loss of appetite or feeling fully quickly. Unexplained weight loss. Those are the early stage symptoms. We also have the advanced symptoms. That is the jaundice, yellow skin, eyes, swollen abdominal, severe pain, and also nausea, eye bruising or bleeding, whitening, white chalky stool, and dark urine. You know, when I talk about cancer, my dad was diagnosed with breast cancer. And most of the time, especially in our villages, like years ago, we would talk about cancer, and everyone would fear cancer. And especially that time we were undergoing the chemotherapy and radiotherapy with my dad, I used to cry a lot. I used to cry because I really love my dad. So with me understanding, or even the society understanding that anyone can get cancer, my dad would go for loss of appetite or even weight loss. And most of the cancers, they have weight loss. Like now we have seen that the liver cancer has one of the sign early stage is unexplained weight loss. And also loss of appetite. You feel you don't want to eat. So a lot of people those people who start showing the early signs, they usually have those the early symptoms. Then they also goes to the advanced symptom, that is the jaundice, the swollen, the severe pain, the upper abdominal, the nausea and vomiting, the eye bruising, and also the white chalky or stool or dark urine. Also, we have the emergency symptoms. The emergency symptoms also are like confusion or slurred speech, confusion or slant speech, and also vomiting blood. Vomiting blood also, it's the emergency one. Then what causes liver cancer? What causes liver cancer? That is my next slide. What causes liver cancer? What causes liver cancer? Number one is the chronic viral hepatitis. That is the chronic viral hepatitis B and C. And we have learned from Madam Stephanie that one of the diseases that affect our liver is the hepatitis B and C. And hepatitis B and hepatitis C are the leading cause of liver cancer. The viruses causes long-term inflammation leading to cirrhosis. That is severe liver scarring. Over time, scar tissue replaces the healthy liver tissue, increasing cancer risk. That is the chronic viral hepatitis. It is the leading cause of liver cancer. Two, it is the excessive alcohol consumption. Excessive alcohol consumption. Repeated alcohol exposure causes chronic inflammation, that is hepatitis. Liver cells die and are replaced by tissue in process called fibrosis. Over the years, fibrosis progresses to cirrhosis, where healthy liver tissue is replaced by non-functioning scar tissue. Cirrhosis severely impairs liver function and creates an environment where cancerous mutation thrive. Meanwhile, chronic alcohol use weakens the immune system, making it hard for the body to detect and destroy abnormal cells before they turn cancerous. We have our defense mechanism in the body. That is the white blood cells, which helps to fight the abnormal cells in the body. So when you take a lot of alcohol weakens the immune system. Hence, the body is unable to destroy the abnormal cells in the body, or the abnormal cells that they can turn cancerous. Three is the non-alcoholic fatty liver disease, non-alcoholic fatty liver disease, and also NASH. These are people who usually take the obesity, those people who are obese. When you have a lot of weight, weight is also connected to diabetes. So weight and obesity and diabetes causes fats build up in the liver. The liver processes and stores sugar. And as I said, we usually our mouth is for speaking and eating. So when we take our breakfast, when we take our lunch, when we take our supper, our foods usually contains a lot of fats. And here in Kenya, especially here in Kenya, we have fats that you need to use a lot of heat. You need to use a lot of heat for it to melt. So if you're using around 200 degree to 300, or even over 400 degree, 200 to 300 degrees for the oil to melt, or for the fats to melt. You can imagine when you go to the body is the body it's only 37 degrees, and you're taking something that needs a lot of heat. So what are we doing to our body? It means those fats are the ones that brings like the fatty liver, the liver not to process or to store well. So with obesity, it is because obesity and diabetes causes the fat buildup in the liver, and this triggers the immune response, and it releases an inflammatory chemical. Thus, liver cells become injured, leading to balloon degenerating or swollen damaged cells. It leads to damaged cells. We call it the fatty liver. This is the fatty liver, mostly caused because of the junky foods or what we take. And chronic inflammation causes scarring, that is the fibrosis, as the liver tries, as the liver tries to heal over time. Fibrosis can progress to cirrhosis, and cirrhosis is the first hashtag, we can call it hashtag, or the first causes of liver cancer, because those people who have 30% of people who have cirrhosis, it develops to cancer, it develops to liver cancer. Number 4, it is the aflatoxins exposure. The aflatoxins exposure. Last year or 2 years ago in Kenya, we had oil that the government was banning because it had a lot of aflatoxins, the mold, and also the ungas, the industry that are producing ungas, they are using the maize that has a lot of mold. So the government used to ban, but now we don't have, the government is not banning. So we can imagine even the oil that the government was saying it has a lot of aflatoxins. We don't know whether we are taking it. And because we are among the developing countries, even in Africa, South Africa, we are developing. So some things the government just keep quiet because industries are producing a lot of employment. So the government might shut up and not say anything. But aflatoxins also is the toxins produced by mold on poorly stored grains or even fats, commonly some developing countries. And also this is among not only liver cancer, but also even other types of cancer. Aflatoxins is one of the causes of cancer. Number 5 is the genetic condition. Genetic condition is because of the disease, like the iron overload, increase the liver cancer risk. It increases the liver cancer risk. Then we can go to the stages of liver cancer progression. The stages of liver cancer progression. We have the stage 1. Stage 1. Stage 1 is a single small tumor confined to the liver. It is a single confined tumor. 2 is it's either a single large tumor or multiple small tumors. 3 is large tumor or cancer that has spread to blood vessels or lymph nodes. We can see them there. 4, it is the metastatic. Cancer has spread to the other organs, lungs, or even bones, etc. That is the stages of liver cancer, Then, how is cancer treated? How is liver cancer treated? We know that with most of the cancers that affect our organs or our body, they undergo surgery. And that is the tumor removal if the cancer is small and localized. If the cancer is small or localized. And cancer cells spread very fast. If the tumor has been removed and the cancer cells are still there, they can also determine to go to the last one, like the chemotherapy, but to go to the second one, the liver transplant. The liver transplant, That is the replacing the diseased liver with a healthy donor liver. That is for the early stage cancer. For those people who are on early stage cancer, they can have the liver transplant. Also, we have the localized treatment. The localized treatment, that is the second one. This is destroying tumor with heat, cold, or ethanol injections, or embolization. With embolization, mostly it's blocking blood supply to the tumor to shrink it. And very few, it works with very few, especially when the cancer cells is very young. Embolization does also good. Number 3 is the radiation, and radiation is targeting where the cancer cells are, targeting the cancer cell hub, and that is the high energy beams to kill cancer cell, high energy to kill cancer cell, but not all that can be killed. And also we know the side effects of radiation: vomiting, loss of hair with the chemotherapy, vomiting, loss of hair, and nausea. You find that those people who are going under chemotherapy or radiotherapy, mostly it kills, it doesn't know whether it's the good cells or the bad cells. It kills all of them. And most of the time I say that is where green oil products comes in, because like APOL helps to boost the immunity, and the rest helps to make sure that the cells, the white blood cells, are renewed. We'll come to see which are some of the products that helps the white blood cells to be renewed very fast in the body. And you know, white blood cells helps to fight the abnormal cells in the body. Then also we have the immunotherapy. Immunotherapy, that is the boost the immune system to fight cancer. This is effective in some advanced cases. It is very effective in some advanced cases. Then we have the chemotherapy, used when other treatments aren't suitable but less effective for liver cancer. It is used for when the other treatments aren't suitable, but it is very less effective to liver cancer. And how do we prevent liver cancer? The next slide. The first one is getting vaccinated for hepatitis B. Getting vaccinated for hepatitis B. We saw that hepatitis C doesn't have, you cannot be vaccinated, but with B you can be vaccinated. Also, 2 is limiting alcohol. With liver, especially with liver and kidneys, we usually talk alcohol, stop taking alcohol. It will cause kidney failure, or it will cause the liver disease. And also, when you limit alcohol, taking alcohol will lower your immunity. It will lower your immunity. So when you stop taking alcohol, it will you'll be able to prevent liver cancer. And most of the times I usually say that we have 2 types of people. We have the one who takes sodas, or the drinks, the sweet drinks, and also the alcohol. I usually say the only difference is the churches we go. Those who take alcohol, they are different church, and those who take sodas are different churches. But the results for both of them, the soft drinks, the sweet drinks, are the same, because all of them, they bring the same thing. Number 3 is maintaining a healthy weight. Make sure you have a healthy weight, because we have seen that obesity can cause liver cancer, because it can also result to fatty liver, because those people usually take the junky foods. Also, eating a balanced diet. Here in Kenya, when we say we eat well, eating well is early in the morning, you take 2 sausages, you take 2 mandazi or 2 queen cakes. and a samosa. Lunchtime is taking it's taking rice and potatoes and meat. Supper is taking ugali, the processed unga, ugali, and also skuma, that is the vegetables, and the vegetables and meat. That is that is what we say when we tell people that we eat well. And through the plate, the diet plate, what we have taken throughout the day, you find that we take a lot of processed food, we take a lot of starch, we take a lot of fats. That is what we say we are eating well, especially in Kenya. So eating well, it's not that, especially for us, it is not that, because we are taking fats, we are taking starch, we are taking fats and starch every day, without taking vegetables, without taking fruits, without taking whole grains. We don't take whole grains, we don't take vitamins, we don't take fruits or that provides with vitamins. So we need to understand eating a balance. What is eating a balanced diet? What is eating a balanced diet? 3 is practicing safe sex and avoiding needle sharing. When I was reading about what causes hepatitis B, and I saw it's having unprotected sex. I only thought is STD and HIV can be affected. You can be affected by not using by unprotected sex, and also I came to understand even hepatitis B, you can be affected by not doing safe sex. So practice safe sex and also avoid needle sharing. Also, regular checkups. Make sure you get a regular checkup. We have our quotum. It detects the fatty liver and also your liver very well. So regular checkup is very, very good. And 3, make sure you use the Greenwald healthy products. Make sure you use the Greenwald healthy products, because they will help you to replenish, to nourish, and also to detox very, very well. So the next one is the products we can use. The products we can use when you have a person with liver cancer. The first one is the Ganoderma Plus capsule. Ganoderma Plus capsule, it is rich in antioxidant and protect liver cells. It is rich in antioxidant and protect liver cells. It protects liver cells. Because it is rich in antioxidant, it helps to neutralize harmful free radicals that contribute to oxidative stress, a process that can damage liver cells and promotes the development of cancer. Also, number 2, it has anti-inflammatory properties that help alleviate chronic inflammation, a key factor in the development of liver cancer, especially in conditions like cirrhosis or hepatitis B or C. So with its inflammatory properties, it helps to alleviate chronic inflammation. 3, it increases the activity of immune cells like natural killer NK cell and T cells, that is the white blood cells, which play a role important in recognizing and destroying the cancer cells. The Ganoderma helps to multiply or to increase the growth of white blood cells, which are the defense mechanism in the body, and they're able to fight for the abnormal cells in the body. This evidence from the studies of Ganoderma extract, it suggests that Ganoderma inhibits the growth of liver cancer cells, and also it is able to, especially with those people who are undergoing chemotherapy and radiotherapy, it is also able to help fight the side effects of chemotherapy and also radiotherapy. 2 is the Livergen capsule. Next, the Livergen capsule. The Livergen capsule. Liver is with liver can regenerate, can regrow again very, very fast. And with Livergen capsule, it supports, with the Livergen capsule, it is support liver cell regeneration and fat metabolism in the liver. They also assist in liver detox and reduce the damage the liver cells by toxins produced by the cancer cells. It also reduces the damage of the liver by cells, the damage to the liver cells caused by cancer cells. And also, it assists in liver detox. It also assists in the liver detox. Liver, it is processed and stores fats. It processes and stores fats. So liver also helps. Liver also is, it can regrow itself, and with the help of Livergen capsule, it is able to metabolize fats and also be able to regrow again if it is damaged. 3, we have the multivitamin. The next slide, the multivitamin. With the multivitamin, as I said, the liver helps to process, store vitamins and also fats. It helps to process, and to store vitamins. These are we have types of vitamins that are stored by the liver, like vitamin A, vitamin D, vitamin E, vitamin B12, vitamin B6, vitamin D3, and all of them plays they're very essential in maintaining liver cells. They're very, very essential. Like vitamin A, it is helps with aiding the detoxification process. Vitamin D helps with immune function. The vitamin E helps with protecting the liver from the oxidative. Vitamin E, and vitamin E, we know they are antioxidants, so they're able to protect the liver from the damage caused by the oxidative stress, and also with the overall immune system of the body. The overall immune. Vitamin B3 plays a crucial role in cellular energy production and also detoxification. Those are types of vitamin C that are stored and processed in the liver. And vitamin C is not stored in the liver, so we need to take it from our daily meal. We need to take it from fruits, our daily meal from fruits. If you don't have time to go and shop for fruits, and we have a lot of people who are unable, because they are working in the offices, they are unable to go and shop from the office, you can sell them the multivitamin, or you can sell them the vitamin C. So liver is a deadly, liver cancer is deadly, but often preventable disease by understanding risk factors like hepatitis, alcohol abuse, and also obesity. You can take a step to protect your liver. So thank you. I hope we have learned. With that, I can say that. Yes, thank you, Madam
Thank
Rennie.
you. Thank you so much, Madam Machara. We'll go to the next topic about the gallstone. Before we answering the questions.
Yes.
Okay, just a moment. I'm going to start sharing the slideshow of the Gallstone. Now, can you see the slide? Can we do it?
Yes, gallstones.
Okay, all right.
Common health conditions of gallstones. Gallstones, it's stones, are common yet often misunderstood health issues that affect 3 to 10% of adult population, especially in Africa, and it affects 2 to 3 times to women. They are likely to develop than men, and we will come to learn how to treat and also prevent them. How to treat and prevent them. What are gallstones? Gallstones are pebble-like deposit forming in the gallbladder, a small organ beneath the liver that stores bile, a digestive fluid produced by the liver that helps break down fats. They can vary in size from as small as grain of sand to as large as a golf ball. And some people may have multiple gallstones at once. Some people might have multiple gallstones at once. And they primarily consist of cholesterol stones, most common the yellow green in color, cholesterol. Also pigment stones, the smaller, the darker, and made of bilirubin. The gallbladder job is to release bile into the small intestines to help digest fats. Normally, bile dissolves cholesterol, but if the liver excretes more cholesterol than bile can handle, it crystallizes into stones. So, if the liver excretes more cholesterol than the bile can handle, that is where they crystallize into stones. They form stones. On the other hand, conditions like cirrhosis, infections, or blood disorder can increase the bilirubin, leading to pigment stones. Or if the gallbladder doesn't empty efficiently, bile becomes concentrated, promoting stone formation as well. And that is the work of the gallbladder. So we'll go to the risk factor. The risk factor, the next slide. The risk factor. The risk factor for those people who are likely to get gallstone, as I said, women are likely to have gallstone 2 to 3 times than men, 2 to 3 times than men. And women, especially pregnant or hormone therapy, are more prone due to estrogen. They are more prone due to estrogen. Estrogen increases the cholesterol secretion into bile, making it more likely to crystallize into stone. Meanwhile, high estrogen levels, especially pregnancy, hormonal therapy, or menstruation time, reduces gallbladder contraction, leading to stagnation. So women are more likely to have gallstone than men. 2 is the age. The age. With the age, we understand most of the organs. When we age, they age, and one of it is the age. The slides are moving. I can see it well. So one of them is the age. The age, and people over 40 have higher risk. The gallbladder become less efficient, less efficient at contracting and emptying bile with age. This is similar to how arteries stiffen with age. The gallbladder muscle weaken over time. That's the bile sits stronger in the gallbladder. So people who are overaged, they have a higher risk. They have a higher risk of getting gallstones. 3 is obesity and rapid weight. Obesity and rapid weight. When we talk about so many diseases that affect our digestive system, we see that obesity and diet are among the risk factors that causes a lot of digestive diseases. So you can see, like, when we were talking about liver disease, we saw about the obesity and also the diet. Now it's Gallstone, about the obesity and also the diet. So obesity and rapid weight loss increases the bile cholesterol. It increases the bile cholesterol, raising gallstone risk. So rapid weight loss, e.g., because of the surgery, can also trigger gallstone due to sudden cholesterol release. So the gallbladder, so the obesity and rapid weight loss can also bring the gallstone formation. Also diet, high fat, high cholesterol, or low fiber diet. The gallbladder main job is to release bile to help digest fats and dissolve cholesterol. Eating too much, especially the foods contains cholesterol, it leads to the gallbladder to contract more frequently over time. It can lead to gallbladder fatigue. It leads to gallbladder fatigue, making it less efficient to emptying bile proper. As a result, bile becomes stagnant and concentrated, hence the risk of stone formation. That is the dieting. Also, with the low fiber, not taking low fiber. Fiber is I could say it's the only thing that God created for it to cleanse the digestive tract, because when you talk from the mouth, go through the stomach, the ulcers, the constipation, the intestines, we usually talk about take a lot of fiber. It will help with the growth of the mucus in the body. So also fiber helps to bind cholesterol in the gut. It helps to bind the cholesterol in the gut, and also to remove from the body. It is able to remove the fats from the body. Without enough fiber, more cholesterol get absorbed into the bile, hence making it thicker. Fiber also help digestion and preventing bile from sitting too long in the gallbladder. Not only in the gallbladder, even in the like we have the chitosan. We have two types of fiber. We have the chitosan and we have the mycelium. When we talk about the chitosan, we see that it's a fat magnet, so it helps to remove or to prevent the bile to sit too long into the gallbladder, or to sit too long into the stomach, or even into our arteries, not to form the bad cholesterol. So fiber also, it's very, very important. Also, diabetes, and those people who have diabetes also are linked to higher cholesterol levels, hence it can be a risk factor of gallstones. Also, genetic also can be can play a big role in, or the family history can play a big role in formation of gallstones. Next slide. Thank you. These are signs and symptoms. With gallstone, I could say it's the same thing with the liver, because it is mostly a silent one. It is a silent one, no symptoms. However, if a stone blocks a bile duct, it can cause sudden, intense pains in the upper right abdominal or the upper abdominal, the upper stomach. So with this, with it doesn't have it is a silent one. It doesn't have some symptoms. However, if a stone blocks, it can cause a lot of pain. It can cause a lot of pain in the upper or right abdominal side. And also, it can bring a back or shoulder pain, nausea, or vomiting. And also, it can result to jaundice, that is the yellowing of skin. Yes, if the bile ducts are blocked, fever and chills, signs of infection. If left untreated, if it is left untreated, there is a complication that we could say it's an inflamed gallbladder or infection can occur. And from here, signs and symptoms. When you see these signs and symptoms, make sure you rush that person to the hospital as soon, because it can burst. It can burst. And the treatment, you can see some of the treatments that you can be given. That is the next slide. Some of the treatments that you are preferred to do. The treatment, the first one is the medical treatment for mild cases. For mild cases, e.g., they can take the they can take the diclofenac used for gallbladder pain. That is the pain reliever. They can take a pain reliever. It also helps to relax the bile duct for stone massage. It also help to it also help like it is a pain reliever. It is a pain reliever. Two is the or three is a surgical treatment. A surgical treatment. This is the most effective for those people who have gallbladder, especially if it is started with a severe pain, like the sudden pain. The surgical treatment is the most effective. It is the most effective. They are different. We have like a laparoscopic. In Kenya we have it. In Kenya we have it, and South Africa and Nigeria also they are available. We also have the open one, the B open, used when laparoscopy is not available. It is used when laparoscopy is not available. When it is not available, they usually go for the B1. But it is a higher complicated one. With a higher complicated one in infections and longer recovery, it takes a lot of time to recover. Also, we have the CERCP, the CERCP. This is the it removes the stone stuck in the bile dust, doesn't remove the gallbladder. It doesn't remove the gallbladder. It removes the stone stuck. It requires specialized endoscopy centers. We have very few in Africa, very few in Africa who can do that. The next one, for those people who have mild or the symptoms of gallstones, you can the ones that are mild, they can take Greenwood products, and that is where we'll come to now. Which are the products that you can give to a person who might be having the gallstones? Next slide. The first one is the chitosan. Chitosan is a fiber. It's a fiber. Chitosan is a fiber. We call it a fat magnet. It is a fat magnet. Chitosan is a fat binding fiber that acts like a molecule sponge in the gut. It traps cholesterol and bile acid from food, prevent their reabsorption. This forces the liver to use more cholesterol from the blood to make new bile, lowering bile cholesterol, thus lowering the risk of cholesterol stone formation in the body. Chitosan also is marketed as a weight loss supplement because it binds to dietary fats, reducing calorie absorption, and also it is slow the weight. It is slow the weight and also help prevent the gallstones. Meanwhile, chitosan has anti-inflammatory properties that may reduce gallbladder irritation. It is an antioxidant effects could protect liver cells, improving bile duct. You know, the liver is the one that produce the bile. So it protects the liver, improving the bile production. This may help the chronic gallbladder inflammation. This may help preventing the chronic gallbladder inflammation. So because of its anti-inflammatory properties, it helps to reduce the gallbladder irritation. Also, the next one is the deep sea. The deep sea. Deep sea is, as I said earlier, we usually take a lot of cholesterol that needs a lot of degrees for it to melt. And our body cannot be able. Hence, those cholesterols are the fats. The fats are the ones that sticks in our arteries, stick in our stomach, stick in our intestines, and also they stick in the liver is unable to process them well. So, omega-3 fatty acids, omega-3 fatty acids helps to lower the triglycerides levels and also improve the overall lipid profile of the HDL or the good cholesterol in the body. It helps to improve the good cholesterol in the body, reducing the bad cholesterol in the body. And with gallstone often develop where there is an imbalance in the component of bile, which is produced by the liver and stored in the gallbladder. One of the main risk factor of developing cholesterol-based gallstone is the high cholesterol in the bile. So omega-3 fatty acids, they are able to lower the bad cholesterol, that is the low LDL cholesterol, and helps to improve the good cholesterol, that is the HDL. Also, it is able, by improving the cholesterol balance in the bile, omega-3 may reduce the risk of cholesterol crystal formation, which is the first step in gallstone development. So it is able to balance the cholesterol and reduces the formation of cholesterol in the gallbladder, which is the first or the most that makes the gallstones to develop. The third one is the liver gel. The liver gel. Livergen, it is a herbal ingredient. Help optimize the liver function by enhancing its ability to synthesize bile, which may reduce the likelihood of bile becoming too concentrated or sluggish, both of which contribute to gallstone formation. So Livergen helps to optimize the enhancement or the stability of the bile. Then we have the lecithin. The next one is the lecithin. Lecithin also, we find lecithin also is very good when we talk about the digestive tract system, because it helps with because lecithin improve the gallstone health by promoting bile balance and also prevents the formation of gallstones. Cholesterol gallstones or a cholesterol gallstone, that is, it helps to preventing the formation of cholesterol. Why? Because lecithin contain phosphorycidine, a phospholipid that emulsify cholesterol, preventing it from crystallizing, thus reduce the formation of cholesterol gallstones, which are the most common types of gallstones. So it also helps to improve bile composition. Lecithin increases the ratio of phospholipid to cholesterol in the bile, which improve bile solubility, and also reduces the risk of gallstone formation. So we can see that lecithin increases the ratio of phospholipid to cholesterol in bile, which improve the solubility and reduces the risk of gallstone formation. And you can see also lecithin is very, very good when it comes to preventing formation of cholesterol in the body and also in the arteries. Now, how do we prevent the gallstones? How do we prevent the gallstone? That is the next slide. How do we prevent the gallstone? How to prevent gallstones? When some risk factors like genetic cannot be changed, lifestyle adjustment help prevent gallstones. One is maintain a healthy weight. Avoid a rapid weight loss also. Eat a balanced diet, high fiber, healthy fats, olive oil, fish, low refined sugars. Low refined sugars. Yes, low refined sugars. I don't know whether we have the brown sugar around these days. Especially here in Kenya, I don't think there's brown sugar. And if there is, it's a question mark. Stay hydrated. Make sure you stay hydrated. Helps the bile stay fluid. Take a lot of water. If you want to maintain your health, you take slimming tea in the morning. You can have your slimming tea or cooling tea in the morning. There are people who usually, me and water, we are not friends. I cannot take cold water at all. I cannot take warm water. So they stay. They don't take water. So most of the time, you can tell them to. You can sell the blueberry juice. They can put the blueberry juice. The blueberry juice is it's antioxidant, and it will also be a benefit to them because it will be able to fight the oxidative stress in the body. And we have seen how the oxidative stress causes the growth of abnormal cells in the body. So if they want to stay hydrated, they take a lot of fruits. You can advise them on the blueberry juice, our blueberry juice. Exercise regularly to reduce cholesterol buildup. Because of how busy we are, you find that some of the people, they go to the office, they just sit down from 8 a.m. to around 11 p.m. They go home, just go and sleep. So they don't have time. They don't have time for exercise. So you can advise them on our circulatory machine. It helps with reducing the cholesterol in the body. Also, limit fatty and processed food. Decrease cholesterol in bile. Limit food that contains fats. And I remember one lady went to to the hospital. She had a high blood pressure, and the doctor tells her not to take a lot of cholesterol. And she goes home. She was given the blood thinner, and the blood pressure it got lowered. So she went back to the doctor, and with the kienyeji chicken. Kienyeji chicken is the original chicken we have in Kenya, the kienyeji chicken, and told the doctor, "Thank you so much. Your medicine are really doing well." And these days I'm not taking a lot of cholesterol. And the doctor told her, "Please tell me what you're taking in the morning." I stopped taking uh, uh, I only take mandazi to mandazi to mandazi, and lunchtime I take chapati. I am not using a lot of oil in my food. And the doctor said, mandazi or chapati, we put actually in the we put in in the oil, and you're saying you're not taking a lot of she was saying she was using the small spoon for the oil in her food. So so it's good to make sure we limit the fatty. As greenwood distributor, understand what are the things that can help your client to reduce fats in the body, like chitosan. It can really do well. So decrease cholesterol. And in a few days, she went to the hospital with a high blood pressure again. So make sure you advise you advise your clients. We advise ourselves on also how to prevent gallstones. Not only gallstones, with the digestive disease. Uh, most of the risk factors that we have learned from the gallstones and also from the liver cancer. Most of the risk factors of which that results to liver cancer and also to gallstones are resulting the same with the digestive tract system. So take care of yourself. Gallstone can be silent or painful, but understanding their cause and symptoms help in early detection. While surgery is often the best solution of symptomatic cases, preventing a healthy lifestyle along the Greenwood product is the key. Thank you so much. I hope you have learned. And thank you, Madam Reni, for this great opportunity you have given me. Asante. Thank you, Mr. Goodman, too.
Asante sana. Thank you so much, Madam Macharia, for this wonderful, wonderful and informative presentations. So thank you so much. Let's see what questions we have. I think, your presentation is quite clear and to the point, so we don't see many questions. After this, I'm going to share all this slideshow and the notes with Mr. Budiman, so you can ask him if you want to do the same presentations in your team. So I think, ladies and gentlemen, it's time that well, I think I'm going to hand it over to Mr. Budiman, so you'll be able to say thank you and good night. And if you have any questions, you can interact with the two great presenters.
All right. Thank you, Madam Rainey. What a wonderful training today by Ms. Stephanie and Madam Macharia. Merci beaucoup, asante sana. Madam Rainey, before we close, I have one question. Actually, I've been waiting for this. Regarding the hepatitis B and hepatitis C, because the cause is because of from the virus of the hepatitis B and hepatitis C. Can we involve our natural antibiotics like garlic oil, propolis plus, or aloe vera plus into the treatment?
Actually, we have antiviral products. Very important, we have the A power, and also we have the propolis. Garlic oil is very good in kill the bacteria, but propolis is good for both the viruses and the bacteria. And also we have A power. A power is not only for HIV. It's not for the specific virus, but it is broad spectrum antiviral products. So you can definitely take the A power and incorporate it as part of your dietary supplement. So this is a great question. Feel free to add the A power capsule. So if you have any kind of viral infections.
Thank you. Thank you for the clarification. Now we have one
Please,
of
I
the
also
strongest
have a
products
question.
for the antiviral, which is A power, and also can be combined with Propolis Plus. And it's very interesting, today's training about liver and also gallstone. I've been noticed in the chat box one thing that some of our distributors has been asking, can we detect hepatitis B and C? Can we detect gallstone using the quantum resonance magnetic analyzer? So here I can give some points. Please, we don't depend too much on quantum machine. When you are doing consultation, your clients is having consultation with you, it's better you do some interview. If they already went to the hospital, they have the doctor diagnose, it will be much better for you. So we really know what is the problem, because somehow quantum machine, we cannot see everything inside, and even the accuracy is not that high. So I really suggest not only depend on the quantum machine, but it's more about communication with your client during the consultation. So later you can find out, you can summarize what are the real problems and which products to be given correctly. All right. Thank you. Thank you, Madam Reni, for support to African region trainings. Thank you, Madam Acharya, Madam Stephanie Kalinga. We really appreciate your trainings. And ladies and gentlemen, thank you. Eid Mubarak. Today we are celebrating the Eid al-Adha for the Muslim brothers and sisters. So I would say Eid Mubarak to everybody, to all the Muslim and Muslimah. And stay tuned. Next week, next Friday, we are going to have another interesting Friday Zoom online training as usual. So just wait for the invitation. And about the recording of this training, I will share through the WhatsApp group on Monday morning. All right. Thank you. We can unmute ourselves and say thank you and bye-bye.
Thank you.
Thank you very much and bye-bye.
Thank you, Madam Stephanie. Thank you, Madam Machera. Thank you.
Madam Kalenga.
Thank you.
Thank you.
Everyone.
Thank you, Greenwood.
Thank you, thank you, thank you.
Thank you all today. Good night, everyone. Bye bye.
Good night. Good night, everyone.
Good night.
Thank you. Bye-bye.